Namaskar, hello and welcome to Sansad TV. I am Namrata Singh and you are watching Question Hour. The show focuses on important questions raised by the members in both the Houses of Parliament concerning matters of national interest. In the Rajya Sabha, members from various parties posed questions related to 10 ministries and sought responses from the respective ministers. Similarly, in the Lok Sabha's Question Hour, members from diverse parties raised questions pertaining to 8 ministries and sought responses from the respective ministers. Now let's take a look at some of the questions whose replies were tabled in both the houses. Rajya Sabha member Dr. K. Lakshman asked the Minister of Agriculture and Farmers Welfare the objectives and expected outcomes of the Viksit Krishi Sankalp Abhiyan campaign scheduled for May to June 2025 and the role of the scientist teams visiting villages and the nature of their interactions with farmers.
प्रधानमंत्री श्रीमान नरेंद्र मोदी जी का ये विजन था कि जब तो पिछले साल 129 नई बीजों की किस्मों को देश को रिलीज कर रहे थे, तब उन्होंने मुझे कहा कि कृषि मंत्री लैब टू लैंड को जोड़ने की कोशिश होनी चाहिए। वैज्ञानिक रिसर्च करते हैं, शोध करते हैं, अनुसंधान करते हैं, लेकिन वो शोध, रिसर्च और अनुसंधान रियल टाइम में किसान के पास पहुंचना चाहिए। लैब टू लैंड जोड़ने की कोशिश होनी चाहिए। और ये सभापति महोदय, इसके लिए हमने शुरू किया विकसित कृषि संकल्प अभियान। देश के इतिहास में ये पहली बार हुआ कि हमारे हजारों वैज्ञानिक, 2170 टीमें हमने वैज्ञानिकों की बनाई और वो वैज्ञानिक गांव में गए। मुझे बताते हुए प्रसन्नता है कि 60,900 से ज्यादा गांव में हमारे वैज्ञानिक गए और वो खाली हाथ नहीं गए। उस गांव की एग्रो क्लाइमेटिक कंडीशंस क्या है और उस कंडीशंस में गांव में जो माटी है उसमें पोषक तत्व कौन से हैं, उनको ध्यान में रखते हुए वहां कौन सी फसल उगाई जाए, कौन सी किस्म उपयुक्त रहेगी, कौन से बीज उपयुक्त रहेंगे, ये जानकारी लेके गए।
Lok Sabha member Om Prakash Bhupal Singh asked the Minister of Ayush details of new yoga training centers set up in the country, particularly in Maharashtra, along with the amount of fund allocated. Whether government proposes to set up more new yoga centers across the country and whether government proposes to strengthen infrastructure of the yoga centers to promote yoga. The ministry in its reply informed the House that since public health is a state subject, setting up of yoga centers and appointing yoga instructors come under the purview of respective state or union territory governments. Ministry of Ayush is not maintaining specific data related to functioning of the yoga centers. However, the ministry is implementing the centrally sponsored scheme of National Ayush Mission through state or union territory governments for development and promotion of different Ayush systems in the country, including yoga, and providing financial assistance to them as per the proposals received in their state annual action plans. State or union territory governments may avail financial assistance by submitting proposals through state annual action plans as per the NAM guidelines. Under the National Ayush Mission, Ministry of Ayush is implementing the operationalization of 12,500 Ayushman Arogya Mandirs through state or union territory governments. At all these Ayush AAMs, yoga is being taught to the public for general health promotion as community-based intervention by qualified yoga instructors. Rajya Sabha member Rajendra Gehlot asked the Minister of Rural Development the district-wise number of houses proposed for construction and fully constructed in the state of Rajasthan under Parliamentary Awas Yojana Gramin. The ministry in its reply informed the House that in order to achieve the objective of housing for all in rural areas, the Ministry of Rural Development is implementing Pradhan Mantri Awas Yojana Gramin with effect from 1st April 2016 to provide assistance to eligible rural households for the construction of Pakka houses with basic amenities. The Union Cabinet has approved the proposal for the continuation of the Pradhan Mantri Awas Yojana Gramin during financial year 2024-25 to 2028-29 for construction of 2 crore additional rural houses. The state of Rajasthan has been allocated a total target of over 24,97,000 and both SECC 2011 based permanent wait list and Awas plus 2018 list of the state has been saturated. The ministry further informed, under Pradhan Mantri Awas Yojana Gramin, central assistance is released directly to the state or union territory, considering the state or union territory as a unit. Further release of these funds to beneficiaries is done by the respective state or union territory governments. Further, central share of over 3,000 crore rupees has been released to the state of Rajasthan since financial year 2022. Lok Sabha members Arvind Ganpat Sawant and Sanjay Uttam Rao Deshmukh asked the Minister of Health and Family Welfare whether government is aware that there has been a sharp increase in cases of heart attacks in the country during the last 5 years, whether government has conducted any study or research to ascertain the said reasons, and whether government has launched any scheme for public awareness, regular checkup and treatment to prevent heart attacks. The ministry in its reply informed the House that the data regarding cases of heart attack is not maintained centrally. Heart attack cases are not notifiable and there is no central registry for the same. Indian Council of Medical Research, National Institute of Epidemiology conducted a multi-centric matched case control study in 25 hospitals across India. Cases were patients aged 18 to 45 years admitted in the study hospitals with newly diagnosed AMI between October 2021 and January 2023. Controls were patients aged 18 to 45 years admitted in the same hospital for other causes matched for time of hospitalization. Information was collected regarding the various risk factors. Key findings of the study, not yet published, are as follows. Hospitalization with AMI was associated with presence of any known comorbidity, family history of thrombotic event and ever being smoker. Receipt of vaccination against COVID-19 had no effect on the risk of AMI. Even in those without any comorbidities, family history of thrombotic events and ever smoking was associated with increased risk of AMI. ICMR in the last 2 years has funded 2 centers of advanced research for research on cardiac disorders. Center for Advanced Research and Excellence in Heart Failure Phase 2, Sri Chitra Tirunal Institute for Medical Sciences and Technology, Kerala. Impact, cost effectiveness and sustainability of a synergetic, multi-pronged, customized, low-cost intervention package to reduce cardiovascular disease burden among diverse populations across India. St. John's Medical College Hospital, Bengaluru. National Health Mission provides technical and financial support to the states and union territories under the National Program for Prevention and Control of Non-Communicable Diseases. Cardiovascular disease is an integral part of NP-NCD. Under the program, 770 district NCD clinics, over 6,000 community health center NCD clinics, 233 cardiac care units have been set up. Further, a population-based initiatives for prevention, control and screening for common NCDs including diabetes and hypertension has been rolled out in the country under National Health Mission as part of comprehensive primary health care. Under the initiative, persons more than 30 years of age are targeted for their screening. The Pradhan Mantri Jan Arogya Yojana offers health insurance coverage for over 50 crore people, covering secondary and tertiary cardiac care, including angioplasty and bypass surgeries. The Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana and affordable medicines and reliable implants for treatment, Pharmacies improve access to affordable cardiovascular medicines, stents, and implants, reducing out-of-pocket expenses and supporting long-term treatment adherence. Lok Sabha member Abhay Kumar Sinha asked the Minister of Women and Child Development specific steps taken for the effective implementation of the schemes of women empowerment like Beti Bachao Beti Padhao and Mahila Shakti Kendra in Bihar, particularly in the rural and deprived areas. He also asked the details of the funds allocated or spent on these schemes in said state during the last 3 years. The ministry, in its reply, informed the House that Beti Bachao Beti Padhao scheme was launched on 22 January 2015 to help address declining child sex ratio and related issues of empowerment of girls and women over a life cycle continuum. In the 15th Finance Commission period, Beti Bachao Beti Padhao as a component under the Sambal vertical of Mission Shakti has been expanded to cover all the districts of the country, including Bihar, through multi-sectoral interventions, encouraging greater spend on activities that have on-ground impact. The scheme focuses on creating mindset and behavioral changes towards the girl child by informing, influencing, motivating, engaging, and empowering various stakeholders. To address this, Ministry has developed an operational manual which inter alia includes a thematic calendar for suggested convergence activities at district level with month-wise specific themes for holistic development of the girl child and to ensure year-round engagement of girls, their families and communities. For effective implementation, funds are released on the basis of sex ratio at birth status of districts as on 2020 to 2021. The financial assistance is provided to the districts with SRB less than or equal to 918 is 40 lakh rupees per year. The district with SRB from 919 to 952 is 30 lakh rupees per year. And the districts having SRB more than 952 is 20 lakh rupees per year respectively. The state or union territories have been authorized to utilize up to 25% of the total allocation for advertisements and media advocacy under Beti Bachao Beti Padhao scheme using a whole of government or convergent approach. The Mahila Shakti Kendra scheme was approved in November 2017 as a centrally sponsored scheme to empower rural women through community participation.
Well, that is all I have for you in this edition of Question Hour. Stay tuned and thank you for watching Sansad TV.